Hey guys, this is Dr. Tim here with Optimized Wellness Center. Today we're with a patient who is going through an ozone therapy, and we're going to talk with him briefly about that. So bear with me 1 second and we're going to check in with him and learn about his first experience with ozone. All right, hi there, Jose. Thanks so much for being willing to share your experience with ozone. So I wanted to get a little bit of clarity about what was going on and brought you to even consider doing an ozone therapy initially.
Sure. So I've been battling type 1 diabetes for a while, and it's just been getting a lot harder recently with gyms being closed and stuff, and I felt like my immune system needed a boost, and also, just regain control of my health. And when I looked up treatments for immune system boost or support, I found ozone therapy, and I just, Googled it, ozone therapy near me, and I found you.
Terrific.
And I had my first treatment 2 days ago. And
what were the outcomes of that treatment? What did you notice initially?
I think just a lot of things changed. First of all, I had the best sleep of my life last night. Second, my glucose levels are actually as if I didn't have diabetes. And I know that's like really hard to say, but I mean, I woke up with perfect sugar levels. I ate a cup of some carbohydrates, and I didn't even see a spike at all in my sugar levels, which was amazing.
And it was carbs, but also sugar. Like you had fruit, right?
Yeah, exactly. And just great sleep, better control of glucose just after one therapy. And also another thing I've seen is that I can breathe a lot better for some reason. I'm a lot more mentally aware and alert. I feel a lot more, I guess, alive, you can say.
So speaking of which, we're doing what's called as BOOO, which is breathing ozone through olive oil, which you can see identifiably here. Mm-hmm. And so that is bringing that ozone obviously into your face through the nose, right? The nasal cannula, but also into your lungs. And so this is great that you're not only getting improved respiratory capacity, your ability to breathe better, but then all those effects, that's really tremendous. What had you been trying before? What had you been doing before even trying ozone therapy?
Really not much. But one of the things I noticed, especially with type 1 diabetes, is that if you don't take care of it, you'll end up having to increase the amount of insulin that you have to inject. Yeah. And yesterday, the day after I took ozone therapy, I kept eating what I tend to do, maybe a little bit healthier, but the amount of insulin I needed to cover my spikes was very minimal compared to what I was injecting in the past.
And if I remember correctly, by contrast, you had indicated to me that you were noticing you were having to increase your dosages.
Yes.
Yeah.
Yeah, it was such a relief to just have to inject a little bit. It's just, it's so great.
Hey, that's terrific. Thanks so much for sharing your experience. Is it okay if we post this on YouTube or on our channel? Okay. Hey, I'm so glad that you're doing well. Thanks for sharing. All right, take care.